Hi everyone, today I will be demonstrating the new Mounjaro pen to Appetite from Eli Lilly. And this is a demo pen that I have here, so it's pretty much the same except obviously we don't have the medication inside. I recommend before you get going that you either wash or gel your hands and then you are sterile for administrating your medication. There's a few parts to the pen itself. So we've got the safety cap here, we've got the dial, and then we've got the window, which shows you when you have reached the right level for you to administer your medication. And I'll go through all these components individually. So like I said, this is a demo pen. So if we take the top off, we would normally see a window here that would have our medication inside. It's clear liquid, so if the liquid isn't clear, then don't inject the medication and speak to your provider about that. At this stage, what we'd do is we'd place the pen down and we will then take a needle. These are single use. Something like a Novafine needle or a BD microfine needle is supplied with your pen from whoever you are getting your pen from. There's a back tab just here that we peel off, and then inside you can see the back connection of the needle. At this stage, what we do is we then screw that onto the top of the medication, like so, and then we have two safety caps. We have safety cap 1, safety cap 2. Safety cap 2, and that's the needle just there. At this stage, what we want to do is prime our medication so that we are ready to inject. And the dial screws out, and I'll demonstrate that now. So as we start turning the dial, we see all these little sort of lines come up, and what we are waiting to get to is it will come up with a 1, and all the pens are pretty much like that, and you can't actually turn any further. So this is you loaded, you lined up with a 1 with the little arrow pointing there. You now have the needle on, and then you have an option. You can either inject into the tummy, you can inject into sort of the thigh, or even into the deltoid if you want. What I recommend is it's a once weekly injection, so into the tummy is sufficient. And all you do is you lift up your t-shirt, you grab a little bit of tummy, you then insert the needle, and then you push down. So let me show you in 3, 2, 1, and you're pushing down, and you're going all the way in to administer. At this stage, the needle's still in, and I recommend you at least count to 6 seconds, but count to 10 is probably a good bet to make sure that you've deployed all the medication. The reason we count to 10 is that we don't want to pull the needle out too quickly and the medication hasn't been deployed into the subcutaneous layer, i.e. the fat of your tummy in this instance. We then remove the pen out. You can then take the needle off, and you can throw that in your sharp spin. If you haven't been provided with a sharp spin, then other options for you is emptying out a jam jar or Dolmio jar. You can put those in there because you don't want to be throwing your sharps into your general waste. You can then take your sharps down to your local pharmacy and ask them to discard. Now, normally your provider should give you a sharp spin, but this is just a recommendation in case, for whatever reason, that hasn't been done for you. So that gets thrown in your sharp bin. These are all just extra bits of plastic and paper that you can throw away. At this stage, what you do is you discard those, you pop your pen back on, your lid, back on, and you put that wherever you're choosing to store it safely, so it's out of the reach of children or anyone vulnerable that might try pick up the pen and do something inappropriate with it. So this video is just an educational video. This isn't medical advice. Obviously, that should all come from your provider, but this is just an idea about the new Mounjaro pen and how it works.